Over to you, Rebecca. We have...
Okay. Just to introduce myself again, I'm Rebecca Bailey from the USAID-funded Capacity Plus project. Before I start, I'd just like to ask if anyone can tell me the WHO definition of a health worker. Nobody. Okay.
All individuals who are involved in providing healthcare.
Good enough. All people engaged in actions whose primary intent is to enhance health. It's coming from the World Health Report 2006 on working together for health. It was a seminal report in human resources for health. And the reason I bring up that definition is because it's talking not only about clinical workers, but also about non-clinical workers who are also frequently called management and support workers. Unfortunately, national health workforce planning and development tends to focus on the clinical cadres, with little attention to other workers who are critical for health service delivery. So those who perform what we call under-recognized functions, such as supply chain management, often lack the support and voice and health systems, which hinders their education, their career development, and their professional growth. And so for this reason, Capacity Plus has adopted a life cycle approach to describe the key steps needed to professionalize under-recognized cadres, and this is based on our experience working with professional cadres. So cadres are workers who carry out under-recognized tasks, frequently lack professional councils and associations, a voice in the Ministry of Health, job descriptions or job descriptions that specify those particular under-recognized tasks that they're completing, career pathways from junior to mid-level and senior posts, formal pre-service education programs, continuing professional development, and a profession-wide learning agenda that comes through having formal pre-service education programs where there's opportunity to do research in the area, research on the profession, etc. So this situation, as we've been talking about earlier this morning and yesterday, often leads to positions or functions doing those tasks who were not necessarily prepared or trained to do those tasks. So we see nurses doing a lot of logistics or supply chain management functions when, in fact, a logistics professional would be more apt to do those kind of functions. So the life cycle approach proposed includes 3 phases that are highlighted. I won't describe this whole chart, but they're highlighted in gray here, which is the education, initial employment, and then support for career progression and development. And in addition, there are some cross-cutting actions across the bottom related to advocacy, policy, and finance that support those 3 phases, the education, employment, and progression, as well as actions to mitigate gender discrimination, which we find in a lot of situations related to education, employment, and career advancement, particularly for females. In the cross-cutting issues, examples of cross-cutting actions there are, for example, conducting workforce needs assessments to support information-informed policy development, or creating and updating supply chain strategic plans that include a workforce component, or on the other side, including supply chain cadres in human resource for health policies, strategies, and plans, and involving supply chain champions, who all of you in this room are, in health sector policy discussions, and also conducting the operations research to demonstrate the benefits of professionalization. So those are the cross-cutting environmental actions that support the professionalization. And then in the first area, or the first phase of education, there are 3 key activities that we've identified. First is actually secondary education that needs to prepare and ensure secondary graduates who are interested in the field and prepared to go on to higher studies. And this can be done through awareness raising in secondary school environments, active recruitment of students into this field, as well as, in some cases, bridging programs. We've found that even with recruiting rural medical students, they don't necessarily have the science and math background needed, so there are bridging education programs to get them up to the level they need to then move into those studies. Then with the pre-service education itself, standardized competencies and curriculum, as well as adequate accreditation, funding, faculty, infrastructure, resources needed to produce the graduates. So basically functioning pre-service education programs. And finally, this education must lead to recognized certification or credentials, such as a diploma or a degree from a recognized institution, or a certificate or license from a professional council, or in some cases, you find both in some professions. In the initial employment, there are just 3 big areas, but they require a lot of action and work. First of all, suitable job descriptions. There was a question earlier about, if you introduce new cadres, how do you ensure that they're absorbed into the labor market? They need to have the job descriptions. Those posts need to be created with clearly specified supply chain related tasks, and they need to be recognized. There also needs to be a coherent system of supervision. So again, we find sending people off to be trained and then putting them back in the same environment, if they don't have the supervision and the support they need, it's very difficult to apply the skills that they have. And then a well-defined chain of authority, which often can be described through an organizational chart, which we've seen some organizational charts earlier today and yesterday, which really help people to understand where they fit in the hierarchy. Finally, under support, the career progression. So in order to retain supply chain staff in the workforce, they really do need some specific progression and support. And this will motivate them, to help motivate and reward them for good performance. And it includes adequate salaries and benefits and training to help keep their skills up to date. Opportunities for continuing professional development, including research and engagement in professional associations to share knowledge and provide peer support. To illustrate some of the challenges that countries face in professionalization, Capacity Plus completed a desk review of the situation in 4 people that deliver countries. And this table shows some of the findings. For example, in cross-cutting issues, only 1 country had addressed HR for supply chain management in a national strategy, and 2 of the 4 countries had established a supply chain technical working group or unit within the Ministry of Health. In under education, 2 countries only had included aspects of supply chain management in pharmacist education, and 2 had established education programs specifically for supply chain management. Under employment, all 4 countries were relying heavily on pharmacists as senior level supply chain managers. And we all know that pharmacists are not necessarily trained as logisticians. So you could see that the employment area was lacking some specificity in terms of the competencies needed and the job descriptions for supply chain management. And in fact, only 2 countries included supply chain management tasks in their job descriptions. Finally, in terms of support for supply chain workers, 3 of the 4 countries did have a pharmaceutical association or society, but we found that few of the logistics personnel were members of those associations, and none of them had a specific supply chain management association. But we also did find that 3 of those countries had members in the International Association of Public Health Logisticians. So finally, to conclude, modern health supply chain management requires a very different array of knowledge and skills than the traditional health sciences. And the life cycle approach defines actions to ensure that these skills are valued, developed, recognized, and applied. For example, formal education programs in supply chain logistics management can enhance both knowledge and professional practice in supply chain management. And career pathways and opportunities for continuing professional development can increase retention and enhance supply chain capacity over the long term. And professional associations, such as national or international health logistician associations, provide important platforms for advocacy and knowledge sharing, and also for peer support among supply chain personnel to give them a voice in policy discussions. Thanks very much.
Fantastic. Thank you very much.